Hi, so a quick video today on lower back disc injuries and the treatments that we provide here for that. There's two things we do here. One is spinal decompression, and the other is a class 4 laser. I've got Jim here. Say hi, Jim.
Hello.
Jim is a patient of mine. He was actually in a car accident, and as a result, he's got a disc injury in his lower back. And so we've been treating him with the spinal decompression table for the disc injury in the lower back, and also the class 4 laser treatment, which we'll show you here in a minute. So we've been treating him for a little while. Jim's a really busy guy, so it's been kind of off and on. But just give us a quick rundown, Jim. How do you like the decompression treatment for your disc injury? Tell us what it does for you.
I love the decompression. Basically, when I came in, I couldn't walk upright. Was kind of a humpback or something, and every time I come in and do this, then I can stand up a little straighter and walk with a lot less pain. So
perfect.
It's a lot better.
Yeah, that's about what happens for people with these disc injuries. It really wipe people out. So the decompression helps quite a bit. So what we're going to do is we're going to show you real quick what the decompression looks like. So Jim, you know what to do. I'm going to have you lie on your back here as usual, all right? And I'm going to get you all strapped into the table here. So the decompression treatment is really gentle and comfortable. It's not aggressive. So put your arms up over your head, Jim. Does it hurt at all to be on the decompression table, Jim?
Oh, it actually feels really good.
Feels good, yeah, okay, perfect. So this top strap just holds his body in place. The bottom strap is the one that's going to do most of the work here. So we're going to put this one on real nice and snug. Again, this is not going to hurt. It feels real good though. So we're going to put this one on here. We're going to get that nice and tight. Perfect. All right, so then I'm going to attach to the bottom strap the rope here that's attached to the actual decompression device here. Excellent. All right, so for comfort, we're going to put these pads under your knees here so you don't have to hold your legs up during the treatment. All right, perfect. So over here I can set all kinds of different factors, how much pull we want to use, how long we want to run the treatment for, how we want the cycles to run. Okay, so we can do it. Typically we run a treatment for 10 to 15 minutes, and it goes through cycles where it pulls, holds, and releases. Pulls, holds, and releases. And the point of treating a disc like this is it causes negative pressure inside the disc so it can draw either a herniation or a bulge back closer to the center of the disc. This decreases pain and inflammation. All right, so we're going to run Jim on the table for about 10 or 15 minutes, and then we're going to show you the laser treatment here in just a minute. All right, so this is the second part of Jim's treatment. We just did his decompression treatment to decompress that disc, and now we're going to hit that disc with a class 4 laser. This is a very powerful laser. It penetrates up to 2 inches into the tissue, so we can really get to that L5-S1 disc that we're treating on Jim here, okay? And what it does is it decreases pain, and it decreases inflammation, and it speeds up tissue healing. Discs have a really poor blood supply in adults, so they heal kind of slow, and this really accelerates that healing process. It does not hurt. Does this hurt at all, Jim?
Oh, sir.
No, sir. All right.
A little cold at first, though.
It feels a little cold at first, but in general, what people experience is warmth during the process, and that's all it is. It's just this roller ball we're going to be rolling on his back. So let me demonstrate that for you real quick. So when you hear that beeping noise, that means the laser's coming out. And we're just treating this area. We're going to keep it moving over the area, or else it would get too hot. But otherwise, once this ball warms up, all Jim's going to feel is the warmth of the laser. And we're going to do this for about 8 or 10 minutes on this area. It kind of depends on what you're treating, but that's the average length of a treatment for the laser. All right, so we're going to do some more on Jim in just a minute, but if anyone out there has any questions about disc injuries or how these treatments might help them, please give us a call. Talk to you soon.